Well, hello everybody. Just absolutely delighted to be here with you, and what a wonderful session we're in for today. The first of many, we hope. So as Priya's introduced me, I won't do that again, but suffice to say that I'm one of a number of people who are involved in this project and initiative, and this initiative is really occurring by virtue of the World Universities Network. We had an idea, as occurs, we had a collective idea, and we tried to make that idea come to reality, and we were able to do that with the funding that we received through the Worldwide Universities Network earlier in the year. And so to be standing here now speaking with you and seeing that idea from such a while ago come to reality is really remarkable and very, very exciting, and a real privilege. So I wanted to acknowledge the World Universities Network, particularly as they have a focus on bringing partner universities together and fostering an international research collaboration that is directed specifically at problems of global significance, and nurturing early career researchers in that, and giving opportunities for some of those early career researchers to start to have an impact and make a difference. So yeah, really proud for our team to be funded by the World Universities Network. And we have a lovely team of partners from other World University Networks and non-WUN universities as well. So I wanted to acknowledge them. Some of them might be with us today. Colleen Norris from the University of Alberta, Julia Slark from the University of Auckland, Professor Walalik Pampung and Dr. Warit Tanoi from Hidal University in Thailand. From the University of Leeds, we have Professor Sonia Kumar, and from the Universitas Indonesia, we have Assistant Professor Henning Pujasari. And thank you very much for our guest speaker, Koi Rujal, who's going to speak shortly. Distinguished Professor from Taipei Medical University. And finally, we have Dr. Mustafa Adam Kolo from the University of Maduguri. I hope I said that correctly, Maduguri, in Nigeria. So those are our university partners, and we're so proud to be working together to bring this forum to you. So my presentation is called Navigating Upstream, and looking at conceptual models to inform thinking around upstream social determinants of health. And I love conceptual models, and I particularly love them because they are so, they generate a different way of thinking and engaging with a particular way of thinking or understanding something. And so we, Professor Chow, who's going to be speaking shortly, presented to a forum at the Universitas in Indonesia 2 years ago. And I and my colleague Albie were there, and we listened to Professor Chow's presentation, and what she spoke about really touched us and really inspired us to start thinking about what role nurses have at the upstream level of social determinants of health. And that term upstream isn't always widely used or widely understood. So I went in search of some conceptual models to help demystify that. So here is one. Now, this is not a nursing model, but I will, you can see that it's a very structured model, that it has a continuum from downstream to upstream, and it becomes sort of more related to the social conditions than individuals. So that's what we would expect. And so the further away from the individual health and towards the population and global factors, that it becomes, more upstream. So there's no real, it's a continuum, so there's no real defining line, and that's what I've found in trying to search for a conceptual model that gives a definitive representation of upstream social determinants. There isn't one, and that's really okay, because that allows fluidity and space, and also for new ways of thinking to occur. So so this is one model that I think is a very attractive model and very visually engaging, and it does tell an interesting story. This one was designed by a regional health service, so it's actually for a local setting, but you can see so easily how relevant it would be for a larger context. And then beyond this, I saw this is possibly close to my favourite. conceptual model representing the upstream social determinants of health. And I think you can see why. It's a pretty neat and clean and clear representation of what might be considered, downstream, midstream, upstream. This model does have little sort of distinctive segments, nominally, but it also represents a stream. So there's also going to be flow between those different segments. And as you'd expect, downstream is about the individual impact, midstream is at that neighbourhood level, and upstream is at the community and the impact that it can have on that interventions have at the community level. The thing I also like about this model is that it divides on each side. You've got the strategies and you've got the tactics, and I absolutely love the use of the word tactics because it's unusual, it's novel, and it draws you towards it and makes you wonder what does that mean, and so the strategies are what you need to do, and the tactics might be how you would do that. So the thing about conceptual models, I think that's really useful too, is that it does it allows you to interpret and to make meaning out of something for yourself, and to you can, the more you look at a conceptual model, often the more you see. And the reason that I'm sort of presenting it so early in our discussion is to contextualize what we mean by upstream, and to also let you know that there isn't one definitive definition, but that is also okay. Now, another model that I came across, and many of you might know this model by Fawcett and Ellenbecker, which was developed published in 2015. And it's called the conceptual model of nursing, or as Jacqueline Fawcett calls it, a nursology. So Jacqueline, considers that as a specialty discipline, nursing, and that has its own body of knowledge, that we actually, she much prefers and uses, assertively uses the term nursology. And the more that I read it, the more interested and likely I am to start using it myself, because I think it's resonant, and it's also got, I mentioned the word tactics being novel, and I think it's also novel, and novel things tend to bring people toward them and draw them and interest them and engage them. So I think that's a feature that I'm flagging for future conversations about how do we engage, people around thinking about nurses' role at the upstream level. So sort of hold some of these thoughts for our later conversations. But this is quite a rich model, as you can see, and it's really very much focused exclusively at the upstream level. And but even considering things like genetic factors, which would potentially traditionally be considered at a downstream level, is she's seeing at a broad population level that's an important thing to be factored in and considered in terms of healthcare and approaches. So the healthcare system, the systemic factors, the environmental factors, and then looking at wellness, burden, functional status, life expectancy, all of the classic indicators of outcome. And then I really love this section down the bottom left where she's talking.
Pardon me, Natalie.
Yeah.
I'm really sorry. The time is up. I just wanted to alert you about it. Yeah.
Right. Well, let me flick my images through, because you'll see, if you want to know more, you can come to me. This is a beautiful model. This is an interesting model. This is a gorgeous model, and so on. And these are some student models to consider. So, there you go. I was worried that might happen, but it did. And but I will be around for conversations later. But thanks for your attention. I hope that at least started you thinking